That morning, Kate Middleton did something she had never done before and went to the hospital for a medical examination in disguise. The treatment she received from the doctor was so bad that Kate decided to gradually reveal her true identity. What happened afterward caused chaos throughout England. This extraordinary encounter that would take place in one of London's largest hospitals would not just be a doctor-patient consultation, but a lesson that would question even the British health system. On a rainy February morning, Kate Middleton was meeting with her private secretary Margaret at Kensington Palace. There were piles of letters and complaint petitions on the table. "Your Majesty," Margaret said with a worried voice, "complaint letters from NHS hospitals are increasing. Patients are complaining about doctors' poor treatment and discrimination." Kate picked up one of the letters. A 60-year-old woman was complaining that the doctor addressed her as old, ignorant. In another letter, it was written that patients from poor neighborhoods received second-class treatment. "Having so many complaints is not normal," Kate said thoughtfully. Margaret nodded. "Unfortunately, it appears this situation is widespread. But of course, if an investigation is conducted through official channels," she said, and Kate completed her sentence. "Doctors are warned in advance, and we cannot see the real situation." That evening, Kate discussed this issue with William. "William, I want to truly understand the situation in hospitals, but when I go as a princess, everyone behaves differently." William could understand what his wife was thinking. "Kate, what are you planning to do?" he asked. Kate replied with a determined expression. "I want to go to the hospital as an ordinary citizen, in disguise." William was worried. "This is very risky, Kate. What if you're recognized?" "It's worth the risk, William. I want to see the injustice these people experience with my own eyes," she said, making it clear she was firm in her decision. The next day, Kate began secret work with her trusted makeup artist and costume expert, Linda Harrison. "Linda, I need to look completely different. No one should see Kate Middleton." Linda approached her work professionally. Kate's bright brown hair was changed to dark blonde. Her blue eyes became green with special contact lenses. Her facial features were changed with makeup, making her appear older. For clothing, ordinary jeans, an old coat, and sneakers were chosen. Even Kate's elegant posture was changed. A more timid, more ordinary woman image was created. "Now you're a woman named Catherine Williams, 42 years old, unemployed, single mother," said Linda. Kate looked in the mirror. She really looked completely different. There was no trace of the princess's elegance. She was indistinguishable from an ordinary Englishwoman. "You'll also need to change your speaking style," said Linda. "Simpler English, a more timid manner." Kate practiced this role for several days. She looked in the mirror and spoke in different accents, practiced timid behaviors. Finally, the security issue was addressed. Kate's security team, led by David Harrison, would secretly follow her, but Kate would be completely alone inside the hospital. Fake documents were prepared for the Catherine Williams identity, NHS card, address document, past medical records. Everything was perfect. Tuesday morning at 9 a.m., Kate went to King's College Hospital with the Catherine Williams identity. This was one of London's largest public hospitals and one of the places that best reflected the problems within the NHS system. The hospital lobby was crowded. Dozens of people were sitting in the waiting room waiting their turn. Kate blended in among them. When she went to the registration desk, the secretary asked in a bored manner, "Your name?" Kate tried to make her voice sound timid. "Catherine Williams." "What's your problem?" "I have chest pain. I'm having difficulty breathing." The secretary looked Kate up and down. She had seen her old clothes and timid manner. "Do you have your NHS card?" she asked harshly. Kate handed over her card. The secretary looked at it carelessly. "I'll give you an appointment with Dr. Harrison, but he's very busy. You might have to wait 2 hours." Kate sat in the waiting room. She observed the people around her. An elderly woman had been waiting for 3 hours. A young mother had come with her sick baby, and was waiting helplessly. 2.5 hours later, Kate's name was called. Dr. Michael Harrison was a 45-year-old, overly self-confident, arrogant man. He had worked in prestigious private hospitals and later moved to the NHS, but he had never accepted this transition. His approach to patients was generally cold and distant, especially toward those he considered lower class. The examination room was cold and sterile. His diploma hung framed on the wall, and expensive pen sets and a gold nameplate sat on his desk. When Catherine Williams entered the examination room, Dr. Harrison was looking at the computer screen and didn't get up to greet her. "Sit down," he said without looking at Kate, tapping his fingers on the desk. "What's your problem?" Kate began to explain in a timid voice. "Doctor, I have chest pains. I have difficulty breathing at night." Dr. Harrison finally gave Kate a brief glance. He didn't miss her old clothes, timid manner, and ordinary appearance. A slight expression of disgust appeared on his face. "What work do you do?" The question was cold and judgmental. "I'm currently unemployed, doctor." Dr. Harrison let out a slight sigh and rolled his eyes. "Of course, unemployed. How long have you had these complaints?" "About 2 months." 2 months? Dr. Harrison's voice was now filled with irony. He leaned back in his chair and took a condescending attitude toward Kate. "You waited for 2 months and now you come to the hospital? What happened? Did it become unbearable?" he said. Kate was uncomfortable with this cold attitude, but stayed true to her role. "Because of my financial situation, I couldn't go to a private doctor." Dr. Harrison, playing with the expensive pen on his desk with a mocking smile, said, "Ah, of course. Financial situation. Classic excuse. Always the same story." Kate was surprised. What kind of approach was this? "Doctor, I don't understand." "You don't understand?" Dr. Harrison stood up and walked toward the window. "You managed for 2 months, then run to the NHS. Free treatment, right?" There was astonishment on Kate's face. Was this doctor really talking to his patients like this? She thought, but she needed to continue the game. When Dr. Harrison began the examination, his behavior became even colder. "Do you smoke?" The question was sharp. "No, doctor." "Alcohol?" "No." "Drugs?" Kate was surprised. "Of course not," Dr. Harrison said with a suspicious look. "Unemployed people usually have such bad habits." Kate was trying to maintain her patience, but these words were really hurtful. During the examination, Dr. Harrison's hand was rough and impolite. "Does it hurt here?" he would ask while pressing unnecessarily hard. "Doctor, that hurt a bit," Kate said. "You should be used to suffering. This is the result of your lifestyle." Kate was now in bewilderment. What did this lifestyle mean? Dr. Harrison continued, "Unemployment, stress, poor nutrition. Then when you get sick, you come running to the hospital." "Doctor, You what?" Dr. Harrison's voice had hardened. "People like you exploit the system. You don't work, you don't pay taxes, then you want free health care." Kate's patience was beginning to overflow. These words were not just insulting to her, but to all victims of social injustice. Kate replied calmly, "Doctor, I think there's a misunderstanding. I was working, but—" "But what?" Another excuse? Kate couldn't stand this much disrespect. There was a slight change in her voice. "Doctor, I think you shouldn't treat your patients like this." Dr. Harrison was surprised. How could this timid woman oppose him? "Are you going to teach me how to behave?" Kate stood up. Her posture was now a bit straighter. "I think as a patient I have the right to be treated with respect," she snapped. Dr. Harrison mockingly said, "What right are you talking about? This isn't a private hospital. You're in an NHS hospital. If you don't like it, you can leave." Kate's eyes sparkled. "NHS is every citizen's right, doctor. It's our right as taxpayers of this country." Dr. Harrison laughed and mockingly said, "Taxpayer? Do you pay taxes?" "Yes." Kate's voice was now stronger. And I know what NHS means. Dr. Harrison had noticed Kate's changing attitude, but didn't care. Kate said, emphasizing each letter, NHS, National Health Service, established in 1948 under Aneurin Bevan's leadership for every British citizen to receive equal health care. Dr. Harrison paused. How did this unemployed woman know NHS history in such detail? Kate continued, And doctor, do you remember the Hippocratic Oath? I will protect my patient's health and dignity. How do you know these things? Kate smiled. This was the first clue. I'm an educated person, doctor. People shouldn't be judged by appearance. Dr. Harrison was uncomfortable. There was something strange about this woman. Well, if you're so educated, why are you unemployed? Kate's answer surprised him. Sometimes people leave their jobs by their own choice, doctor. For more important duties. What kind of duties? Kate looked directly at him. Public service, helping people, fighting injustice. Dr. Harrison was now suspicious that Kate was not an ordinary person, but he still couldn't figure out her identity. Kate was now beginning to break out of her role. Her posture was straightening, her speech becoming more fluent. Doctor, Kate said, let me ask you a question. How many patients do you see in this hospital? This doesn't concern you. It does concern me, because every patient is a human being. Every person has a story, a dignity. Kate took out her phone. Dr. Harrison noticed this wasn't a normal phone. It looked very expensive. More than 200 patients will receive treatment in this hospital today, Albert, Kate said, and each one has the right to be treated with respect by you. Who do you think you are? Dr. Harrison was now angry. Kate smiled and dialed a number on her phone. Margaret? Yes, I'm at the hospital. Yes, with Dr. Harrison. Yes, you can make the necessary arrangements. Dr. Harrison was surprised when he heard the phone conversation. Who was this woman? Kate hung up the phone and looked at Dr. Harrison. Doctor, I think your hospital director should also listen to our conversation. Hospital director? Do you know the hospital director? Kate's smile deepened. I know him. I even know the health minister. Just then there was a knock on the door. Hospital director Dr. James Wilson rushed in. Dr. Harrison, Then he saw Kate and froze. Kate stood up, straightened her posture, and removed her wig. When her bright brown hair became visible, Dr. Wilson's breath caught. Your Majesty, he whispered. Dr. Harrison's jaw dropped. The woman standing in front of him was Kate Middleton. Yes, Dr. Harrison. Kate was now speaking in her normal voice. I am Kate Middleton, and I learned very well what kind of treatment I received here today. Dr. Harrison was trembling. Your Majesty, I didn't know. Didn't you know? Kate's voice came out sharp. Well, would you have behaved differently if you had known? Dr. Wilson intervened. Your Majesty, we deeply apologize. Kate stopped him with her hand. Doctor? Wilson, I'm not the person you should apologize to. You should apologize to the thousands of patients who come to this hospital every day and receive the same treatment from Dr. Harrison. Kate turned to Dr. Harrison. Doctor, do you remember what you said to me today? Dr. Harrison bowed his head. Your Majesty, you said people like you exploit the system. You said you don't work, you don't pay taxes. Do you stand behind these words? No, Kate raised her voice. Doctor. Harrison, I came here today as Catherine Williams. But Catherine Williams is a real person, and thousands of people like her come to this hospital every day. Your duty is to heal, to provide treatment. But you judge people, you demean them. Dr. Wilson intervened. Your Majesty, Dr. Harrison will immediately... Dr. Wilson, Kate cut him off. This isn't just a doctor problem. This is a system problem. But the beginning must be made from here. Kate turned to Doctor. Harrison, one last time. Doctor, all I ask of you is this: never treat any of your patients again the way you treated me today." The next day, Dr. Harrison was suspended by hospital management. The health ministry launched an investigation into the matter, but what was really important was the change Dr. Harrison experienced. The lesson Kate gave him had deeply affected him. For the first time, he truly understood how he treated his patients. During his suspension, Dr. Harrison began volunteering at community centers. He provided care to patients without money in poor neighborhoods. A few months later, he wrote a letter to Kate. "Your Majesty, the lesson you gave me that day changed my life. For the first time, I learned to see from my patient's perspective. Thank you." When Kate received this letter, she smiled. She had achieved her goal. When Dr. Harrison later returned to the hospital, he had completely changed. He approached patients with respect, listened to them, and treated them with understanding. He quickly became one of the hospital's most beloved doctors. Kate Middleton's brave move didn't just change one doctor. Awareness was created throughout the entire NHS system. Training on patient rights began to be provided. This story teaches us something important. Sometimes to see real injustice, we need to look from different perspectives. Kate, by abandoning the comfort of being a princess and experiencing life as an ordinary citizen, exposed the problems in the system. And the most beautiful part is that this experience changed both Dr. Harrison and the system. Real change comes not through punishment, but through creating awareness. Kate Middleton proved that day that she's not just a princess, but a true leader. By putting herself at risk, she took action to see and solve society's problems up close. So what would you do if faced with such injustice? Would you remain silent, or would you take action like Kate? Share your thoughts in the comments and tell us the feelings this story gave you. Don't forget to subscribe, because many more inspiring stories await you. See you in the next video.